Thanks everyone for joining us today. We're going to talk about the built environment and getting people outdoors at work. Specifically, we'll be talking about the total worker health approach. And this is the sixth of six of our HealthLinks webinar series for 2022. So thanks everyone for joining us today, and we'll get started. A few housekeeping items before we introduce ourselves. Perhaps you've been on our webinars in the past and you know the drill, you've seen this, but everyone is kept on mute throughout the duration of the presentation. Please use the chat function, and in order to get that going, we'd love to have you tell us where you're joining us from today. It's so great to see people joining from all 50 states, from other countries, and so if you can use the chat and tell us where you're logging in from, we'd appreciate it. We are going to ask you to put questions for the keynote speaker and our other speakers in the Q&A section of the Zoom toolbar. And so if you happen to put that in chat, our technical assistance team will ask you to move that over to Q&A. And the reason we do that is so if you have the same question as your colleagues, which often happens, you can vote thumbs up on that question and you don't have to retype the same question. And that helps us prioritize questions for the Q&A section as well. We are recording today's session and you'll get a link to that. And there is a survey at the end. And in order to obtain your continuing education credits, especially those of you getting CHES credits, we need you to fill out that survey to provide feedback. So thanks for doing that. The link should automatically generate, but if it doesn't, we'll also put the link for the survey into the chat function. And for those of you that need closed captions, that's available as well using the Zoom toolbar. My name is David Shapiro. I am Senior Manager of Programs and Partnerships at the Center for Health, Work, and Environment. Today, I am joining you from our CU campus, University of Colorado campus in Aurora, Colorado, the Anschutz Medical Campus. It's kind of a gray and cloudy day. I am a white male and I wear a beard. I have a brown beard and brown hair. I'm wearing dark gray glasses and a gray shirt today, a button down with a collar. And my Zoom background is a black screen with our HealthLinks logo interwoven in it. HealthLinks, for those of you who don't know, is a public health outreach program putting public health into practice in terms of working with employers throughout every industry and every size on their commitment to total worker health. And our center, the Center for Health, Work, and Environment, is one of 10 centers of excellence for total worker health funded by the CDC, by NIOSH, the National Institute for Occupational Safety and Health. So today we're going to really talk about a total worker health approach to the buildings we work in, how they contribute to our overall health, safety, and well-being, and also the importance of getting people outdoors while at work and how that contributes to our overall health and well-being. We'd like to acknowledge, as we gather today in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of Indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationships to their lands. We recognize and affirm the ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse Indigenous peoples still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of all Native peoples. So today, we have a few key learning objectives, which is understanding the different components of the built environment and how they impact overall worker health, safety, and well-being. Thinking about specific strategies that you might use in your own workplace or bring over to leadership that can enhance your workspaces and encourage employees to get outside. And then also, we'll be providing some resources that can help you assess and enhance the spaces in which you live and work. With that, it's my honor to introduce our keynote speaker for today, Joanna Lombard. Joanna is an architect and professor at the University of Miami School of Architecture with a joint appointment in the Department of Public Health Sciences at the Miller School of Medicine. She holds a Bachelor of Architecture from Tulane University and a Master of Architecture from Harvard University's Graduate School of Design. Joanne is a founding member of the University of Miami Built Environment Behavior and Health Research Group, a member of the Board of Directors of the National Recreation and Parks Association, and professionally links research and design to strategies for the design of healthy communities, with projects that include the development of a healthy building toolkit for affordable housing and consulting with healthcare systems to develop new and retrofit existing campuses. So thank you, Joanna, for joining us today. I'll turn over screen sharing to you.
Thank you, David. Let me open this up. Welcome to everyone. I think we're good. I thought we would go through some of the basics today, and I could share with you kind of the health fundamentals, and then we'll focus on the environment that all of us are in that's kind of beyond the individual workplace, the workplace itself, and then we'll close with some resources and then move to our panel, and we'll have Q&A throughout. So please go ahead and just put questions in as we go along. So what I'd like to start with, first of all, is something that a lot of people maybe don't realize. The House team, Dr. House at University of Michigan, came out with a study in the late 80s that really called the medical world to action, because what that team found is that across all cultures, across income groups, all around the world, all different ages, there was one aspect that predicted longevity and health, and that was social interaction. So this was a kind of, when he brought it out, he said, they discovered at that point that the effect on health and well-being by social interaction was as strong as that of smoking. And so loneliness, isolation has as deleterious effect as many of these other, as smoking does on us. So in, I guess, about 2010, the study came out that Holt Lundstedt did to said, well, we know that came out. We'd like to kind of test that theory. Is that really true? They looked at analyses from all over the world and once again reinforced the House study. So the reason I think these three things are important, I picked out kind of the three top aspects of life in the physical environment that affect how we behave, to understand that if this is the foundation, then we can audit just about any place we are to begin to understand, does it enable social interaction? Does it encourage physical activity? So the next slide you see is the World Health Organization guidelines on physical activity. And there's a great study that Dr. Patel did that came out in JAMA in 2016, which showed that physical activity, some kind of physical activity, even moderate, decreases heart disease, premature death, muscle wasting, cancer. You can basically read these on the slide. And then there's a third component, and this is where our team has done a lot of work, which is the impact of greenness. And what we have found are studies that show these lower reductions in diseases for people in Miami-Dade County. We looked at 250,000 Medicare beneficiaries, and we found that the people who live on blocks with lower levels of greenness were more likely to have lower levels of these disease outcomes. So this is really powerful, because what this tells us is these are three aspects of the environment that we can control that can actually make a difference in our health and well-being. So what I'd like to do is zoom out just for a moment, because our workplaces are not islands. We exist in the context of a larger built environment. And if we look at how does our built environment around us support these three life essentials, and we can kind of see how we do. So those of you who are from New York will probably recognize Bryant Park. This is a fairly recent photo of Bryant Park. And the study that I've cited, so each of the slides will have a study on it, and when you get these, you can look these up, or if you would like me to send them to you, I'm happy to send you a PDF. But this study came out and essentially after looking at the impacts of social interaction and what parks do for social interaction, realized that really every community should emphasize having some kind of space, some public space that community members can access. In Miami-Dade County, our parks director said parks should be within a 5-minute walk of everyone who lives in Miami-Dade County. Those of you that know us know that we're a very sprawling environment, so that's an ambitious goal, but that's an important part of building this community of social interaction. Then physical activity. So again, spaces where we can be physically active. This is a shot from Sugar Land, Texas. But essentially what this study came out to say is strong and sound empirical evidence between physical activity and depression. And at this level, just walking has an impact, and we can see lower levels of depression when we do that. So in addition to all the other things that I showed you, we can begin to see, does our environment give us places to go out? Can we walk? Is it safe? Is it comfortable? And that's where greenness comes into play. So this is a street in Miami. This is actually my street. This is the street I live on, which is demonstrating just obviously we have a pretty high level of greenness here in Coconut Grove, but one of the things we discovered in Miami is just the variety of neighborhoods that have different levels. And this is the study that I mentioned to you earlier. And we're now continuing this work looking at Miami and San Diego over time, and also taking a look in Northern Manhattan on cognitive outcomes. So now, how does this come to the workplace? So I thought this would be a great slide to share with everyone, because I think if I said to you, name a space that you could imagine has the most perfect integration of physical activity, social interaction, greenness, daylight, I don't know that you would pick a psychiatric hospital. But in fact, that is what this model is. And it's important for a number of reasons. You can see from the floor plan where the green spaces are highlighted that pretty much everybody has access to view of daylight and access to daylight and views of greenness. You also see in the images one of the courtyards. And then above that, if you notice the glass walls. So this particular hospital not only brings these aspects out, but the process by which it was created enabled this to happen. So they built this on a study that was out of the UK. They looked, the study talked, it was workshops all over Europe with about 500 people involved in mental health, either as patients or caregivers, family members. And they asked people, what makes you feel, what to you symbolizes mental health? And people said, air, greenness, the smell of grass, daylight, seeing people. So the glass wall provides that transparency, the sense that you can see people. You might not be actively engaged, but you have that distant notion of social interaction. And it also provides the kind of security and privacy that you need when you're having a meeting in a psychiatric hospital. So I thought this was a good example to get this started. And then we'll focus on some spaces that introduce each of these. So this is a space that I chose to show you. The American Institute of Architects has a committee on the environment, and every year they give an award to buildings that have these 10 criteria, health and well-being being among them. And so I picked 3 of these to share with you today because they have social interaction, which occurs through the gathering spaces. You have the serendipitous encounters. There's some great studies on higher levels of higher impact research coming out of buildings and places where people can have serendipitous encounters. There are a lot of different gathering options, so you can actively interact, or you can sit at a distance and feel like you're part of something without actually having to put out too much effort yourself. So there's great visual access. And then notice the place is completely suffused with daylight. This is an important part of it too. And nature is also there. But the key is that when we bring all these things together, we create a place that encourages us to interact as opposed to discouraging us from doing that. Then we can look at physical activity. And I chose this slide because these stairs look fun and inviting. And when you're going up and down these stairs, you can see people that you might want to have a conversation with. You can see outside, you have daylight. And this coinciding access is an important point too, because many times we'll find that the elevator is distant. So if I'm in a wheelchair or on crutches, I go one way and my friend goes the other. So to the extent that these can coincide, that I can see them going up the stairs if they want to, and they can see me going up the elevator, these things make a very big difference. And again, we've now tied ourselves back to social interaction again. And then those of you in New York may have seen this. This is the renovation of the Ford Foundation in New York City. It was a building that was done in 1968, and then Gensler renovated in 2018. But notice the green space. And what now, we can't all have a forest in the middle of our office building, but we can do some things that bring us close. And I wanted to share this with you because on the left, you'll see the green roof, which happens to be the headquarters of the American Society of Landscape Architects in Washington, D.C. It's not that big, to be honest, and you can see there are a few plants there that are cheerful and happy, but it's not an abundance. It's not the Ford Foundation, but it has the same kind of impacts on the people who are there. And then on the right, this is a setting where it wasn't possible to bring in any greenness into that. So they did this study actually at Johns Hopkins, I found out later, but essentially they took 80 patients and they had 40 of them get these nature scenes and 40 did not. And they also added nature sounds. And they found that there was better pain control and less pain. This becomes extremely important with older patients where anesthesia is really not something that you want to overdo. And so the idea that you could, in fact, alleviate pain by introducing a nature scene is important. And I share this with you because this is something that can be done in an office setting in a small way, for example. In fact, there was one of the studies that came out of China recently was, and you wouldn't probably want to be one of these study participants, but it was like a 6 by 8 foot room with no windows. But they put strawberry plants in. So the people who were in the room with the strawberry plants had, their heart rate relaxed. They had lower stress levels, lower levels of cortisol. So even just introducing some tiny little strawberry plants in a otherwise unwelcoming room had an impact. So now we're going to get to the resources. And I don't know, many of you may know about the Wellbeing Institute. Some people might say, well, the Wellbeing Institute's great, but it's kind of expensive to go through their certification process. I totally agree with that. And if you're from the Wellbeing Institute, we can talk about this later. But what I do think the Wellbeing Institute does that's fabulous is that they put all their material out there. So you don't have to go through that certification process to benefit from the materials that they put together. And you can see from the little icons down on the bottom, and then you see the matching color somewhere in the room. And what it's bringing together, if we start to think about community, that's our social interaction. Movement is our physical activity. And then obviously we see greenness. This is also introducing these other aspects of light, air, and ventilation. But there is something about bringing the outdoors in when you cannot actually get to the outdoors itself. But that relationship of having the outdoors accessible through, as you saw in the other examples, you could either have a courtyard, you could have a garden outside, you could even have a green walkway or a green rooftop. And then in the worst case scenario, you can bring it into the building. Well, I shouldn't say worse, but you can bring it into the building through art, which is important. And then in the next image, this one is Joe Allen's work out of Harvard. You may have been hearing about him. He was very active has been active during the pandemic. These are the 9 foundations of a healthy building. And again, if we look at what he's talking about here, we can begin to see that many of the things that we've discussed, especially lighting and views, are really important. And if you notice, the image that he chose for the cover of their book shows you a great outdoor space just beyond. So this is super helpful. And then there's the Living Building Challenge. This was started, those of you that know the U.S. Green Building Council, 2 of the people that were in this, founding group of that decided that what LEED does with its awards, you have prerequisites and then you have elective credits. This says everything's a prerequisite. And if you notice, you can take a look at this and you can begin to see, daylight and access to views, they require 75% of every space. 75% of the habitable spaces should have access to daylight. In the European Union, it's actually up to, I think, 100%. And this applies even for people in, surgical suites. And I can't tell you how many times surgeons say, why must we be in a place where we can't see out? And we don't know what time of day it is. Like, how hard would it be to give us skylights or clear stories? And then I wanted to close on the resources because one of the great resources is right here, this group with Health Links. And the study, in addition to all the studies they do, this employer survey is pretty cool. I went through it myself and I loved this particular piece on access inclusivity. And I think that if we could begin to sort of look around and understand that these are so important to our health and well-being, and we spend a huge amount of time in our workplace, well, then we can start to create these self-audits. And once you start to do these audits, I will tell you something wonderful happens, because you start figuring out small ways to make, changes that have big impacts. And so I really appreciate your taking the time to give this your attention. I think we can make a difference in our own lives and the lives of all the people we work with if we give this some focused attention and some opportunity for change. So David, I'll turn it back over to you and to our panelists.
Thanks so much, Joanna. Really appreciate the presentation and your points today. As a reminder to all of you participating, I'm just going to have you turn off your share screen if you don't mind, Joanna.
Yes.
As a reminder to all of you participating today, if you have specific questions for Joanna and our upcoming speakers, who I'll introduce in a moment here, please put them in the Q&A box. I've seen a few questions already come in, and we'll have some time in the latter part of the hour to ask those questions directly of Joanna and our other speakers. With that, I want to introduce our first speaker on the panel today, Nathan Carr. Nathan is the Business Development Manager at Energy Logic, and in that role, he works with builders of all sizes to help find areas for improvement and opportunities to grow closer to the idea that all homes can be efficient, healthy, and resilient. After graduating with a master's degree in building science from Appalachian State University, Nathan came to Denver metro area to work for a high-performance production home builder. And time spent working for a builder has helped him understand what is important to builders and what information they need to get the job done. Nathan has presented on building science, renewable energy, and home building quality assurance throughout the country, including sessions at Residential Energy Services Network, the Energy and Environmental Building Alliance, and the NAHB International Builders Show. Nathan is also active in the local community, volunteering on issues that are important to him. So Nathan, thanks for joining us today. Tell us a little bit about yourself, the work you do, and I know you're going to talk to us a little bit about indoor air quality in the home office environment. So thank you for joining us, and appreciate your perspective today.
Yeah, thank you, David. Thank you for the invite. Really excited to hear everything that Joanna shared, but I want to throw the one caveat in all of this is that we have amazing opportunities to create great spaces for workers to come, and being engaged in the built environment is so important. Where our focus at Energy Logic has shifted and looked is that amazing research has been done to help identify what can happen in the built environment to create great spaces and great opportunities for people to thrive. And then the big monkey wrench that got thrown in there was during the pandemic, we had so many people working from home. We've seen this large increase in work for home. And so we have these amazing spaces that people are now not using and going into isolation at home. And so we've really been looking for opportunities and resources for people to thrive in their work from home space. So I've been diving deeper into all of that. My background is in indoor air quality, as David mentioned. So I'd love to share at least some tips that we're seeing and some of the challenges in work from home spaces and encouraging worker health in those spaces. So, some of the key areas that we are really concerned about is that homes, and this is a EPA statistic, homes on average can be 3 to 4 times more polluted than their outdoor air around them. This is a concerning statistic when we're spending even more time at home. So we'd love to find opportunities to get people to improve their indoor air quality, which research from the Chan School of Public Health has shown that doing this helps productivity, helps reduce sick days, helps increase worker thoughtfulness, and it's just a great opportunity to engage. And so we are looking at how you can best engage workers at home, how you can make sure that they can be safe, productive, healthy, and effective in those spaces. So I'm excited to see different things that are coming out of the pandemic and different opportunities for people to be happier at home. And we're excited to be a part of that. So I think I'm happy to answer questions and happy to provide more resources around that as well.
Thanks so much, Nathan. I think it's really important for us to all recognize that, hybrid is here to stay for sure. And the home office environment is something that there's a lot of principles from Joanna's keynote that can make our home office environments healthier and more committed to well-being. And then thanks for bringing up indoor air quality. I don't think I realized that indoor air quality can be so much worse than outdoor air quality. And so once again, thinking about the home office environment and specifically air quality, if you have questions for Nathan, please feel free to put them in the chat as well. And with that, I'd like to introduce our third speaker for today and panelist, Dan Siebert. Dan oversees the risk management program for Eagle River Water and Sanitation District, including health and safety initiatives, workers' compensation, property and liability insurance administration, and emergency preparedness. Dan is a veteran of the United States Air Force and earned his master's in applied science with a specialization in environmental policy and management from the University of Denver. Dan is a saltwater aquarium enthusiast who enjoys spending time recreating in the wonderful outdoors with his wife and friends. Dan, thanks for joining us today. You work at a location where a number of individuals are outdoors or going between inside and outside. And we wanted to talk to you a little bit about that experience of people working outdoors. What are some of the health, safety, and well-being things we want to consider as we're moving more people outdoors or as they're working outdoors in general?
Thanks, David. Yeah, so as David mentioned, we have a lot of teammates here at Eagle River Water and Sanitation District who spend a majority of their time outdoors. So it's very important that we ensure that the resources are available to keep them safe so that they can actually enjoy the outdoors after work. We ensure employees have access to sunscreen and sun exposure reduction means like the bucket hat I'm wearing in my picture, all the way through lightweight SPF rated shirts so they can feel comfortable and not get sizzled during the day when they're out in the field completing their tasks. We've also partnered with Go Sun Safe at Work, formerly Colorado Sun Safety, to provide education to our employees. They brought in these really great cameras that can show you if and where you may have already had sun damage, so you can work to protect yourself better in the future. And then finally, we partner with dermatologists and do annual skin cancer screens for all of our employees, which can help them identify and monitor problematic areas. And then for our teammates who get chained to the desk, unfortunately, we encourage walking meetings so they can get outside and soak up some vitamin D. And we place picnic tables around most of our facilities so they can enjoy lunch when it's not going to rain on them. To further encourage employees to get outside after work, we host opt-outside events where employees can recreate together. Over the last few years, we've hosted events for volleyball, mountain biking, stand-up paddleboarding, and even just hanging out at the park. We have hikes to view the changing aspens for all the leaf peepers on this call, and a fly fishing event scheduled later this fall. We even offer a recreation benefit to all our employees that will reimburse them for a purchase associated with a recreational activity to help them get outside. As we all know, the cost for a lot of recreational activities can be a limiting factor. So we're trying to break down that barrier. At the end of the day, Eagle River Water and Sanitation District realizes the importance of their employees' mental health and physical well-being, and we understand that promoting outdoor recreation after work can and will lead to reduced costs. According to the CDC, this should help us lower our direct costs, such as insurance premiums and work compensation claims by taking this path. Feel free to fire any questions you got for myself also. And thanks again, David, for the invite to speak.
Thanks, Dan. Appreciate that perspective. If we should all be so lucky to live and work in the Eagle County and the outskirts of Vail, Colorado. So one of the questions may be coming up for you is how to increase outdoor exposure in more urban areas. But I want to start with the Q&A. And as I mentioned, if you have specific questions, there's a number of questions in Q&A right now. So the first thing for all of you as participants to do is if you have the same question as someone that's already in there, use the thumbs up feature to elevate it up the list list. You don't need to retype something that's already out there. And I think, Nathan, if you're able to rejoin us, and Joanna as well, now would be the time for us to go through some of the questions. So I'm going to start with a built environment question, Joanna, that's in there, which is, or specifically around very industrial spaces. I know that there's like a movement right now
Yeah,
of
I
like
saw
sort of
that.
metal and plants. I keep seeing stores in
Right.
areas that are sort of combining those two. But what if you're in a manufacturing facility or a plant
Yes.
kind of area that, really, how can those workplaces incorporate some of the things that you're talking about?
Well, so I'm glad you asked that, because that one was going to be a longer typing thing.
Yeah.
Well, first of all, there was a really interesting study out of the Harvard Business. It was published in the Harvard Business Review a couple years ago, and they surveyed workers on what was sort of like their number one perk at the workplace. And you could choose, among like fitness centers, cafeterias, childcare. The number one choice was daylight. So the first thing I would say is, if you think back to some of the earlier buildings, I think of the Albert Kahn's buildings in Detroit with these really huge clear stories that open to the sky, right? So that no matter what you were doing, it's kind of what the surgeons were saying. There's a great study with Swedish nurses in ORs who just say, we're desperate to see outside. So I think in any environment, the first thing is daylight and access to daylight. And frankly, it helps with safety. And to Nathan's point about, well-being, it makes a big difference in our productivity and our efficiency. Hospitals that give access to daylight in high intensity care settings find lower levels of patient error, and patient safety is obviously crucial. So I would say daylight. Then you'd be amazed at the small spaces. I was visiting one of the academic offices here at the University of Miami, and I have to confess, whenever I go, I'm always like, okay, if I have to teach in the classroom, I immediately like open the blinds and rearrange the chairs and figure out like, how can I, because you really want the spaces we're in to help us do our job, whether it's at home or, at work. And what I noticed is it's kind of like one of those Warren of offices, but they had a tiny little spot that they had transformed into a kitchen space. And all they did was put like a kind of new light, an LED light that was underneath the counter. And there was a mirror at the end. So when you came in, you could kind of see yourself. And then there was I felt a bit like the slide I just showed you of the nurse showing the patient the landscape. And then there was a landscape on the wall. So when you looked at the mirror, you had a reflection of the landscape coming back at you. So, and everyone was saying, isn't this great? And it's true, you just go there and you sort of felt a little bit of uplift. So I wouldn't be, while there are big things and small things can make a difference. Just, I would look at every nook and cranny and say, what could we do here? But Nathan, you and Dan may want to comment on that.
I want to mention here too, encouraging the example we love to give in this scenario is from another institute on campus here at Children's Hospital Colorado. They really wanted to encourage use of the stairs, which is an older stairwell for employees, and sort of it was all sort of concrete build block. And what they chose to do is they had various high schools and other students come in and paint murals all along the stairwell. And oftentimes there was children of employees that had participated in the mural painting. And now it's this amazing sort of art exhibit as you go down the stairwell.
That's a super great idea.
Yeah. So in addition to bringing nature in, just sort of livening up the space, if there's walls in which you can make it a little bit more fun or bring nature in, it sounds like that's sort of another recommendation for this.
That's a good idea. Yeah, absolutely. You're right.
Yeah, I'm going to switch over to Nathan. There's a number of questions about air quality in the Q&A, Nathan. And so, I think the one that's gotten sort of the most thumbs up votes at this point is, what are some recommendations for improving air quality in a work from home environment? And I guess related to that are resources for checking air quality and what are the main pollutants. So if you don't mind sort of just summarizing a little bit more about what's going on in the air quality of the home office environment, I think our participants would appreciate it.
Yeah, absolutely. So I think when we think about home offices and work from home, really home is the first part, and there's a lot of unique things going on in homes that don't happen in a traditional office that we really have to be aware of. Things like cooking, and just living life, having pets, having these different influences. So really, when we worry or think about things going on at home, some of the major pollutants that we start to worry about and look into would be particulate matter, specifically what's called PM 2.5, particulate matter 2.5 microns or smaller. This is very small particles that can enter your lungs. And then we also worry about volatile organic compounds, TVOCs, or a few specific organic compounds such as formaldehyde. And so these are things that are off-gassing from the cleaners we're using, from scents, from our furniture, from all of these different things that make up our home. And so, when we're looking at how do we understand these, how do we understand what's going on, I think there's been a great movement to provide some very cost-effective, easy to understand, easy to read residential air quality monitoring devices. There's several brands out there that are providing these kind of entry-level monitoring devices that are giving you a good picture of what's going on in the home. Now, it's not an industrial or scientific measurement, and there's some scale in there, but it can give you an idea of when I'm doing these activities, here's what's happening. Things like cooking, vacuuming, cleaning are big impacts on the actual indoor air quality in the home. And so getting that feedback quickly on here's what I'm doing and here's how it's impacting what's going on in the home is important. And so as far as some general advice that I would suggest to people looking to improve their indoor air quality, look for opportunities to bring in outdoor air as a way to reduce pollutants inside the home. Look for opportunities to provide filtration, whether it's in your inside your HVAC system or using a standalone air filter, and then look to really controlling moisture in the home, and then being thoughtful of the materials that are coming into your home, whether it's cleaning materials, whether it's household furnishings. These things have different impacts, whether it's off-gassing of volatile organic compounds or things like PFAs that we are really focused on. What are these going to be long-term impacts on not just the acute air quality, but chronic long-term impacts? I hope that answered the question.
I think so, Nathan. What I heard from you is the first step is really getting a baseline assessment or monitoring sort of what's going on, especially when you're engaged in certain activities. And then you can start to build solutions from that. Is that sort of the recommendation, is assessing current air quality and then moving from there?
Yeah, and I think there's some general things that we can look at for every home. But yeah, definitely understanding what's going on in your home first can allow you to make good decisions. And we kind of look at how can we reduce potential harm, and try to find ways to go from there.
Great. Dan, I want to talk to you a little bit about the outdoor worker experience. We have all learned more about PPE in the last few years than ever before. We think about masks and respirators now as PPE, but you've been with outdoor workers talking about PPE in terms of, as you mentioned, the types of clothing that people wear, the type of hats that they wear, because they're exposed to so much sun and outdoor. And then also something you mentioned about, having skin checks for employees, which is really unique. We don't have too many companies. In fact, I think Eagle River Water and Sanitation District is the only company in our HealthLinks network that provides that service to employees. So, tell us a little bit about that, about how you've been able to work with doctors and dermatologists to offer that screening to employees.
Yeah, great. So just in, the area we're located, just the recreation alone of skiing, hiking, being at altitude, you would notice people, getting sunburnt or things like that. And so that really kind of started the ball rolling on this. So as we focused on the sunscreen and prevention methods, in hopes that employees wouldn't be so sunburnt that they just want to go home and sit on a recliner, but actually go out and enjoy living up here. That's kind of where it came out of. And we have amazing people running our kind of wellness programs and committees. And I believe that was an employee-driven thought of something that would be very beneficial for employees. It kind of reduces the stigma of going into hospitals. We host it in our conference rooms, and they bring in, privacy screens, and it creates an opportunity to get checked out. And hopefully, if something is discovered, you can make a move in time to deal with it and not need to be out of work or get sick from any of the sunscreen or sun diseases that are out there.
Right. Yeah, I really appreciate that. It's one of those things we tell people about, going routinely to see their primary care provider to get their annual checkup, going to see the dentist annually or twice a year for your teeth cleanings, but rarer for us, especially, to consider, skin checks and dermatology screenings, especially if you have a number of people in recreation or that work outdoors. So really an important total worker health approach there. I'm going to go back to you, Joanna, on a question that came up for me. I hadn't really heard the term serendipitous encounters before your presentation. I really like that. I think I'm going to put that on one of the bulletin boards around our office, that we sort of encourage more of these serendipitous encounters. But what do you say? There seems to be a faction out there that's talking about maybe those serendipitous encounters are counterproductive to getting work done and the whole productivity sort of element. I've seen some articles recently about open office environments and that sort of thing. And so what are your thoughts about, we all are looking for those encounters in this era of COVID where we're coming in and we're wanting to interact with one another, but, can they also be, a stymie on our productivity perhaps?
Well, it's interesting you say that, because there have been some recent studies coming out to say the open plan office is kind of a disaster in terms of productivity. We have this in like a lot of our large architecture studios, and it's very distracting, hard to get your work done. What we need as humans, to be honest, is choice. So the idea that you can have a space where you can work privately, a space where you can work out in public when you need to, and a space that you can encounter. So part of it is just signaling. What was nice about your building that we looked at is that you had the space over by the side where, there's a tables kind of together. And one of the things that works really well for serendipitous encounters is actually high tables, because then if you're walking by, you don't have to sit down and talk to me, and I don't have to stand up and talk to you. You can literally just walk up, and I have my laptop and you have your laptop, and it's like, oh, wait, are you working on this? Well, maybe we can talk, right? So, but if you organize those where they're in a kind of place and you're working in that place, then you're signaling like, I'm open to conversation. I'm doing my work, but I'm kind of open. But if you're in, say, one of the glass closed rooms, or if you're, in your own area, well, then that requires a sort of, in the way that we now text each other, we don't just like call each other up and say, hey, you send a text, like, is this a good time to talk, right? Mm-hmm. I mean, except for maybe our moms and, people, but most people will send text to say, is this a good time to talk? And I feel like, and I'm going to tell you right now, for those of you whose moms do that, having lost my mom a year ago, I really wish now that I would have just answered all the calls whenever they came in, even at inopportune moments. So I think that knowing that and being able to signal that through space is important. And that's where having alcoves and choices makes a really big difference. So I don't know if that gets at it, but yes, I mean, basically what we're seeing in all of the research is that all of anything is not right. We're wired for activity. We can be overstimulated, and that can be bad for us. We can be too sleepy, and that can be bad for us. And so we need to kind of find, and what works for us on any given day changes based on how we feel. And so this is why I also said, look outside the workplace. Look outside your house. Are there places to walk? Are there trees that could be planted? Because I really do feel that we shouldn't have to carry all this ourselves. And the workplace can't do it all itself. But if we could start to think about ourselves as part of a community, what Dan was saying about the outdoors, essentially the outdoor workers are the people who I think we have to pay so much attention to, especially with climate change and rising heat levels, and making sure we have cooling spaces. And is our community designed for someone who's an outdoor worker to have a place to go sit and have their lunch and get some relief? And could the buildings where we all work have places that, our lobbies are friendly places that these people might come? And suddenly I meet someone who works for Dan and we have a conversation about, oh, I was noticing this in the stream, and is this affecting my water here? And I just think those kinds of things happen.
Yeah, well, I appreciate that. What I took away from that comment is the mixed methods approach, right? You want to have a variety of things, and perhaps the research that's coming out about open office environments not being great are spaces that are solely dedicated to open office environments, not necessarily ones that have a variety of things. And so with the return to office and hybrid work, and there's at least one question that has come up on this, being intentional about the space. We've talked with a lot of organizations over the last few years about, if you're going to have people coming back, what do you want their experience to be? This is an opportunity for a reset. So do you want to get some new furniture, some high tops? Do you have potentially a budget for that? Are you able to do some retrofitting or some makeshift? We just moved a table and some spaces in our office because we want to make certain spaces more inviting and accessible to individuals to congregate. And so really being into, coming back to the exact same building as it was 3 years ago is probably not what people want. They, if you want to bring them back in a way that's intentional, thinking about how you want them to interact with one another. And as we're mentioning here, there can be small changes that can make a big impact. I do want to touch on what you said about climate and heat, Dan. What are you seeing? You're up in a mountain and rural community where the effects of the sun and heat can be dramatic, but also maybe not as dramatic as at sea level and in other places. But how is the general heat index and heat levels impacting workers at Eagle River Water and Sanitation District, do you feel?
It's definitely gone up. I believe just in September, we've had, 10 days in the high 80s, which, this is fall time. We really have started to hear that feedback from the employees that it's getting hotter out there. Could we get some sunshade shelters when we're doing, continuous work out in the sun? We've noticed that a lot more of our employees are starting to wear long sleeve, lightweight SPF shirts to reduce their sun exposure, keep them cool. And then on the opposite end of the spectrum, we're noticing, last winter, was a lot more harsh. It was a lot colder, a lot windier, less snow. So, you see those patterns and you can hear it from your teammates. They'll let you know exactly how things are going out in the field.
Yeah. Thanks, Dan. Nathan, anything you want to add about how heat and climate change in general affects air quality? Is that something that you've looked at, or that Energy Logic as a company is looking at?
Yeah, I would say that we are very focused on, so we're a building science company, and so energy is important to us, as well as air quality, as carbon impacts. And we've been really looking at how do we maintain quality indoor spaces as this climate is rapidly changing. All of the design assumptions that we would make around HVAC sizing are changing, and we're really trying to catch up to all of that, both in the indoor and outdoor spaces. We were, our clients are homeowners, they're home builders, they're everybody, and we see, different issues around some of the big wildfires in the last 2 years on how do we help create healthy indoor spaces when we have to seek refuge from outside because of the smoke, because of the particulate in the air, and how do we deal with that? So yes, we're seeing changes in both the indoor and outdoor space because of climate change and because of this changing heat.
Well, I appreciate everyone's comments today. We often don't have enough time for Q&A, and I really appreciate the discussion. Any wrap up or final points before we move on to resources? Joanna, is there any, I saw some people asking you about low cost, or if I was to walk away and do one thing, I think I have in my mind a few things to do, but what would you want people to take away from the presentation today if they had to do one or just a few things?
I think the first thing maybe would just be to be attentive, because we all are so busy. We have so many things pressing on us that we just kind of accept certain things in the flow of life. Like, yes, that's inconvenient, or maybe this is dreary, but you're just kind of pushing through a lot of the time. And I think if we step back and just say, is this place nurturing? Is this a place to flourish? And I suspect most of the people that are on the call, because people that are interested in asking these kinds of questions usually are fairly unselfish people. So they'll feel like, I can put up with this, or I can put up with that. So when you take that sort of attentiveness, don't think of yourself. Think of someone you care very deeply about. Think about your student or your patient or your client, or someone who, you're there to make their life better, and ask, what does this do for them? And I think you just can start noticing how small things can really make big differences. So I think first the audit, and then when you start saying, well, why does this space make me feel better? Why does this space make me feel blue? Some of these things are simple, like honestly changing lights. I usually change light bulbs everywhere, just because for me, more light is good. Not everyone feels that way, but generally, studies show that we tend to like a certain range of light. Bright light is better. Somehow I married someone who doesn't like bright light, so I'm always turning them on and he's always turning them off. But I think figuring those kinds of things out. And then I think what Nathan talked about is super important. I think being attentive to the air that we're like, you can kind of sense air motion and smell, and just being quiet and sensing things, and then reaching out to people who can help you. Like, I'm personally going to talk to Nathan after this, because I'm very concerned about, I noticed that there's this like ideal range of productivity with humidity, and more than 55% is not good. So that's kind of where I live.
Thank you so much, Joanna. Nathan, any brief takeaways that you want for people if they were to go out and do one thing related to their home office environment or indoor air quality? What would you want them to do?
I would say some of the biggest easy impacts is start being more thoughtful about the materials you bring into your space. Every time we are smelling something off of a artificial product, it's some sort of VOC. And while some of these haven't been proven to be very harmful, a chronic exposure over time does have some potential health impacts and things to look into. So start being more thoughtful about those materials. Look for lower impact opportunities like that.
Great. Dan, I'll end with you. If you had one suggestion for employers that have a lot of people outside, what would you want them to think about or consider?
Wear sunscreen. We'll just keep it simple. Just wear sunscreen. It'll solve a lot of problems.
Great. Appreciate that. So thank you so much, Joanna, Nathan, and Dan, for your comments and presenting today. Joanna was gracious enough to bring up our Get Outdoors module. We have a self-scoring rubric around the importance of getting employees outside, and we will send a link to this in our follow-up email from today's webinar. And so this is, it's got a few sections to it about the current environment, both indoors and outdoors, and what people have access to, as well as are you encouraging people to get outside to do some of the recreation activities that Dan was talking about, or promoting walking meetings. What sort of other intentional decisions are you making about your workspace? And as I mentioned, it's self-scored, and so this is one where it's completely free and you can do it on your own. If you have questions about the module or you want to take a deeper dive on workplace health and safety, this is a good opportunity to sort of dip your toe in the HealthLinks sort of water, talking specifically about getting outdoors and self-scoring it, and then sort of moving a little bit more deeply into your commitment to total worker health. So as I mentioned, we'll send this as a link and as a resource on follow-up, and it's available to any employer of any size. Also, I want to make sure that everyone is aware, and if you're on any of our listservs, you may have found out that we are hosting in partnership with the CDC, with NIOSH, the National Institute of Occupational Safety and Health, the third International Symposium to Advance Total Worker Health. Virtual registration is still available, and virtual attendees will get a lot of recorded amazing content about workplace health and safety. And so we will also send in our follow-up a link for individuals to register for the virtual portion of the Symposium for Total Worker Health, which is coming up here just in a few weeks. And so we hope you'll be able to join us. And we mentioned that there is going to be a survey as you log out today. We'll keep this meeting room open for a little bit. So you have time to log out, and we always have people that for whatever reason do not catch the link, and so we'll put it in the chat as well. We know how important the survey is for all of you. It's also really important for us to better understand feedback and how we're doing. As I mentioned, this is our final webinar of 2022. It's hard to believe that it's already middle of September, and we're getting ready for the symposium and the end of the year here. We are just in the final planning phases of our 2023 series, and we should be able to publish the six webinars that we're planning on hosting in 2023 very soon. So stay tuned for the 2023 calendar. But yeah, take the survey, and at the end of the survey, there's going to be a link to learn more about that International Symposium for Total Worker Health and register as a virtual participant. We hope you're able to join us there. So once again, thanks to all of our speakers. We've had with today's audience over 3,000 people join us in 2022 for our HealthLinks webinar series. So we're just so grateful and appreciative to all of you that have chimed in, been able to participate, and been, speakers. It's been such a wonderful series for everyone involved, and we look forward to continuing the conversation, whether it be at the symposium next month or in 2023. So thanks again to our speakers and for everyone joining us. As I mentioned, we'll leave the link open for a little bit. Have a great afternoon.